Hey everyone, Joe here, and welcome to your video for Chapter 4, Skeletal System. I'm going to go over the metabolic bone diseases that are listed in your book real quick. And the first one I'm going to mention is osteoporosis. Now, to quickly understand what osteoporosis is, you first have to understand how bone works. You have to remember that bone is a living tissue and that the older cells or the dying cells, they are reabsorbed into the body, and at the same time you have new cells that are replacing those older cells. And so when osteoporosis comes about, you have an accelerated rate of the reabsorption of the old bone, but there's a slowing down of the formation of new bone. And so when that happens, you lose the mineral salts, your bones become a little bit more brittle, and most notably for us is that we notice that it's more of a radiolucent type of bone appearance rather than radioopaque. Now, it does take quite a bit of loss, about 50 to 70% of your bone density, in order for us to kind of indicate this on a radiograph, which is why we don't use x-rays or regular diagnostic x-rays to determine if a person has osteoporosis. We use a DEXA bone densitometry scan. And that's a different piece of equipment. It's still x-ray based, but hopefully you guys have seen the equipment, or at least know about what bone density is. And it's specialized equipment for just measuring the bone density of certain areas of the body. More importantly, areas such as weight-bearing features such as your hips and your lower back. All right, now I'm not going to go into bone density because you don't need to know it, and it's not anything you need to comp on, but I will say this. It's a real easy test to learn, and the more you do it, the easier it gets, and it's really simple. If you can get it for your resume, get it as something that you have in your back pocket that you know how to do. It's always a good thing to have that. So highly recommend, if you ever have the chance to get trained in bone density, do it. But with regards to radiographs and looking for osteoporosis on a radiograph such as this, we're really going to see it on a lateral spine. The two main places that osteoporosis are really going to affect a person's body due to their body weight is, one, their spine, and two, their hips. Now, we don't really see any deformation of the hip or the femoral neck or the femoral head due to osteoporosis. Unfortunately, we find out if something's wrong after it breaks. But with regards to the spine, we do an AP, and even that can be a little tricky to read. But from a lateral point of view, you really get an understanding of what the structure of the spine looks like. And you can see that here. We've got some issues here. Now, I'm hoping you're able to see these wedge fractures or these compression fractures. This one here is incredibly compressed, or I'll show the wedge in a little bit. Here's another compressed vertebrae. Okay. This one is even a little bit compressed. And think about what's happening here. There's a couple of things that happen here. One is you have the weight of the person's head and torso kind of pulling down. And as a person gets more and more kyphotic, the more and more weight is being drawn down this way. And when that happens, that really puts a strain on these vertebrae. And look at this one. Even this one is really not doing too well. So it's really squeezing those. You've got all that weight, and it just kind of scrunches down on those vertebral bodies. The other thing that's happening here is hopefully you'll notice that there's some concavity. You can see that there's like a bulge kind of in the middle. And really what's happening is you've got the intervertebral material that's pretty soft, but it's strong enough to cause that depression in the body. Right there, right there, right there. So it's strong enough to kind of push in the vertebral body from the top and the bottom. And so you've also got that effect too. Now, sometimes these are called wedge fractures because if you looked at some vertebrae and in between you kind of have a wedge. That would be a wedge, kind of like what you would stick under a door to keep it open. Sometimes they're called wedge fractures. So wedge fracture or compression fracture, all pretty much the same thing, all usually resulting from osteoporosis. And so that's what we're looking for. Now, before I wrap up osteoporosis, I just want to mention one thing. The book mentions lowering your KVP, and that should make sense because KVP is your penetrability. It's the energy behind the beam, and so if you've got too much KVP, then you're going to blow right through these bones that don't have much in the way of absorbing the x-ray. So lower your KVP to get a little bit better bony detail. And sometimes we don't know if a person has osteoporosis, but if you do have a patient that you know has known osteoporosis, the regular or the KVP that you normally use is going to be for a person with regular bone density. And so you're going to have to lower that KVP if you want to draw out as much bony detail as possible. So just think about that before you do patients with osteoporosis. Otherwise, you're going to get a washed out spine like this. We still get some okay detail, but if we lowered the KVP, perhaps we could see these bony vertebral bodies a little bit better. So just something to think of. And that's it. That's osteoporosis. If you have questions, again, please get a hold of me through email. Come up and see me, or however it is you want to get a hold of me. And otherwise, I'll see you at the next video.